Welcome to another episode of The Scoop from the Mackinac Center for Public Policy. Today we are here with Charlie LeDuff and Steve Delie. Steve is a attorney here at the Mackinac Center, does a lot of stuff on public records requests. Charlie LeDuff is a client of the Mackinac Center and quite an eclectic background. I don't know, what do you want to say that you are now? He's a podcaster. He does some writing for Deadline Detroit.
I'm a reporter.
He's a reporter, longtime reporter. And we're going to talk a little bit about public records requests and some of the information that Charlie's been trying to get and the Mackinac Center has been trying to help him get. So welcome, guys.
Thank you.
Thanks.
All right, so let's walk through this a little bit. Charlie, what were you trying to obtain from the state? And then we can talk about where we're at now.
Well, what I'm trying to do is get a proper gauge of who died in the long-term care facilities in this state. Now, we say nursing homes, but nursing homes are a subset, right? There's nursing homes, homes for the aged, adult foster care homes that are licensed by the state, and adult foster care homes that have less than 12 people. So 1 to 12, 13 to 20 for the foster homes. The homes for the aged are just like the nursing homes, except they don't have nursing 24 hours. These are long-term care facilities. Every state's keeping track of it. We didn't at all. If everybody remembers, we didn't keep track of these numbers for nursing homes.
For the number of people that were dying of COVID
until June, mid-June, after the big spike in deaths happened. We didn't keep track of the others, the homes for the aged and the adult foster care, until December. So it's gone by now. All of a sudden, in December, we also started getting an asterisk. What are these called again? These are
vital records
deaths.
Yeah. In what the state was reporting?
They would go like this. One day, it's like clockwork. Tuesday, Thursday, Saturday, the asterisk shows up. How many died yesterday? 100 asterisk. 80 of these are vital records deaths. Well, when did they die? Give me the date. How old were they? Where was their primary residence? Was it a nursing home? Was it a long-term care facility? Are you backloading stuff that we weren't looking at? That's what I want to know. And why do I want to know?
Why do you want to know?
Gotcha. No, see, that's not what it's about. I don't play gotcha with politicians. What I want to know is how bad are these facilities and what do we have to do to fix them? For our loved ones, for ourselves. We might be in them. Now, quickly, Biden just announced as part of this gigantic package, this infrastructure package, that nursing homes and these facilities are infrastructure. They're going to throw $400 billion at it. How can you throw $400 billion at something when you have no idea what's happened? So it's a matter of deep public concern, right? It's a matter of good ethical policy, and it's a matter of leaving some room for our kids to be able to have a government that functions and can fund itself.
Well, I'd imagine, even just, you'd think the state just from the beginning would want to know, because some of these were probably doing a better job treating COVID patients and some are doing a lot worse. So you'd think that they would care about that to know what treatments were effective.
But you would think. We think a lot of things in this country, and all of a sudden we never get it, do we?
Yeah, well, we're at a think tank, so we got to do some thinking every now and then.
That's why we have the think tank. It doesn't make sense to us, and we need smart people to do the boring job of giving us data and then putting in some order so we can understand, so we can be an informed public. There's basically, you guys are investigative reporters who don't know how to write.
Yeah, if we get it to the right person, it works out okay sometimes. So what did you request? What were you trying to get?
Real simple. I know from this, if I can back up. April, May, June, July, August, September, October. I have a 2-cell diagram that they sent me from the state. In there's 1,800 of these deaths, these vital records.
For all long-term care facilities?
Just vital records deaths.
Oh, okay.
Right? And then all of a sudden they started exploding in November, December, January, February, March. I want to know how old they were when they died. When did they die? Was it last April? Was it 4 weeks ago? Why won't you tell me? And I want to know where they lived. Because if your primary residence is a long-term care facility, that's where the death goes. You can ask Cuomo about this. That's the game he was playing. They died in the hospital, so it's not as bad as we think. It's 50% greater than we think. These cattle pens, on a good year, before COVID, 400,000 people a year die from communicable virus and disease. They're bad already, 400,000. We're going crazy about 550,000 died of COVID. These people are locked in the dark. And we got to stop it. And I'll make one more point how a state does it correctly. Ohio screwed up with their vital. They screwed up in like October, November, December, January. Oh man, we've had 4,000 more deaths than we reported. It was a data screw up. They found it. They took care of it. They added them in. They didn't add them in as a lump. Each day that the person died, they put it in that column. Okay. If they lived in the long-term care facility, they put it in that column.
Well, and they tracked them by the individual facilities too, didn't Ohio?
Yes. Now, it's important to say, I forgot, in our vital records deaths, they count the death, but the states told me, and I have it in writing, we do not differentiate where they died. You see what I'm saying? So now when the lab suit guys that the governor puts out there, I don't buy it. I'm a redneck and they taught me to read. You know what happens when a redneck reads.
Might learn something.
That's right. They said they don't add them in. So what happens is our nursing home totals start to decrease. Oh, well, wow, we're doing better than the national average. It's because you're jimmying the game. That much I know.
So somebody, they could be a nursing home patient or live at a nursing home or some long-term care. They die at a hospital and they don't mark them down as a nursing home death. That's what was happening in New York.
Right.
My understanding.
Well, here, I don't know.
Yeah, we don't know.
This is just part one.
This is what we're trying to figure out via the lawsuit.
And if we can get part one taken care of, then we are going to ask for, do you have a list of people in the beginning that died in the hospital? Can I see that, please? Maybe. I don't assume anything. I don't think there's any, I don't assume anything.
Yeah, I mean, we really can't make a statement that what happened in New York happened here.
Right.
There's just no evidence yet. And that's, we're trying to get access to these records so that we get a better understanding of, did that happen here? Was our policy here better? Was it worse? And to try and get, the truth of the matter and get it out to the people. And also to figure out, okay, if this did work, we should replicate the policy or tweak it to make it better. Yep. And if it didn't work, well, that's important to know too, because then we have to develop a better policy for the future.
Remember this as well. It's statistically impossible. Right now, we cop to 1/3 of the deaths were in long-term care facilities. You're telling me now that all of these asterisk deaths, not one died in a long-term care facility? By statistical magic, it would be 1/3, wouldn't it?
Right.
I mean, that would be the math, right? That's how that would generate.
Math is magic.
So where are we at, Steve? So what was the request? What was the state's response?
So Charlie already hit a lot of it. It was basic. It was a very simple request. It was 4 parts. It was age of the deceased, date of their death, their residence, and then whether they contracted COVID at a long-term care facility. The state came back, denied that request on grounds of privacy, on HIPAA grounds, and on vital records exemption grounds. Basically, there's an exemption in FOIA for information coming from vital records. We filed the complaint, I believe it was March when we filed it. The state's answer is due here coming up in May, and that's when we'll know a lot more about how the state plans to address this. Be it, can we negotiate some way to get the records that we need, or are we going to have to go to court and actually sue?
And you're not asking for names. You're not asking for this overly personal information. This is, you assume they have to have this.
Well, they do have it. Of course, you press a button and they have it. Ohio's doing it, and it should be said that when they do offer these, they put stuff out already about who can, how many in each nursing home contracted it, how many staff members have, how many died. They're already putting this out. I just want the murky stuff. What's with the murky stuff?
Well, and that's, that's the good point is with the vital records exemption that they're trying to apply, they're already putting out information related to vital records. And we aren't asking for names or any other kind of identifying information for these folks that could compromise somebody's privacy. We really are looking for what I would call aggregated data.
It's a good one.
So you want to know when these people died and where they died and why they died. I mean,
Yeah, let's real clear. How old were they? It'd be nice if you gave me race. That's important to us. We want to measure where it's going on. When you died, when you were added into the list, and where did you live? Simple. Why is this so hard?
yeah, it would seem to be a state interest to really know that and to put it out there. I mean, but the only thing, I mean, it's speculation now, but I mean, in New York, I mean, it was that it looked bad to have more nursing home deaths, and so that's what they were worried about there. I don't know what it is in Michigan. I mean, obviously the governor's gotten criticized on the nursing home policy, but
It's New York's policy. She cribbed it. I say that with certainty. I say it all the time. Just look at the dates of when we're going to commingle red hot patients with people that aren't sick in these facilities. When did you excuse the healthcare industry and the nursing home industry from doing this? The blanket liability waiver. When did you do that? In New York, Cuomo was taking heat in April. The media and everybody else already knew you were bifurcating nursing home and the hospital. It got so bad that Cuomo asked his attorney general to set up a hotline to take tips because he wanted to blame the nursing homes for not following his protocols. By the beginning of May, the governor of New York ordered that it stop. Do not commingle. You have to be clean. You have to have a clean bill of health to go back. Later that month, our governor doubled down on it. And in fact, in some way, it's technical, we're still doing it. And if you've been in these nursing homes, and I have, I've gone in at night and collected dead bodies. They haven't put in the plexiglass. There's not a new HVAC. Public policy. What are we going to do going forward? Are we going to learn anything? And that's what the FOIA is for.
Yes.
with the idea being, what are the places that are doing it well and what aren't, and
Right.
get people to the places that's going to get them the best treatment.
Right.
Well, and that goes directly to the heart of the question that you just asked, which is, why aren't we getting this now? And I think the issue that we have here in Michigan is a culture that is a lack of transparency.
You mean it's corrupt?
Well, I won't say, I won't go that far, but I will say these institutions really do resist transparency efforts. And it's frustrating. I mean, Charlie, we've got our suit, right? But we're maintaining, I think, another 6 right now we have active against U of M, MSU,
U of M.
cities.
Doesn't it say Veritas on their shield? It says it right on the shield. It says it on my diploma. Go blue.
Go green.
Go home.
But I mean, that's what we're seeing. I mean, and the state is just one example of it. We see it under all sorts of administrations. We saw it under Governor Snyder. We see it under Governor Whitmer. I mean, it's hard to get the people's records, and these are public records. There are records. So to have to fight this, it's just frustrating to say the least, I think.
And why are we at the bottom of every metric? Like, we're the least open state in America, right? We're like one of the most corrupt in America. Our education is amongst the worst. Our nursing homes, the water, the infrastructure, the dam. Come on.
Well, I think we need about 9 more of these shoots to get to those issues.
Right.
But for today, we don't really have a ton of answers, but we're working to get them, and we'll stay up to date on where the lawsuit goes from here.
And thank you. I mean, if I might, thank you. I didn't know where else to go. Not a rich man. You're doing great work here. This is needed, and I'm proud to be sitting here. I really am.
We're glad to be working with you.
All right. Thanks, guys.
Thanks.
Thank you.